Are your friends constantly telling you that you look exhausted or even sad? Are you frustrated with your wrinkle cream because the results are no longer satisfying? If you're bothered by persistent under-eye bags that no creams seem to alleviate, or droopy hooded lids that make you look tired or older than you actually are, an eye lift or blepharoplasty procedure can help rejuvenate your eyes and take years off your appearance. Before moving forward with any eye enhancement, there are some basic guidelines that you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons and make sure you're well educated and informed and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one who is actually board certified in facial plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are two types of eye lift surgeries, upper and lower, but oftentimes they're done together for a completely rejuvenated appearance. This video will educate you on all of the eye lift procedure options your doctor might discuss with you. An eye lift of the upper eyelids repositions fat and muscle and reduces excess skin to correct the drooping and puffiness that can make a person look older and tired. This procedure is also ideal for those whose eyelids interfere with vision. If it's your under-eye bags that bother you, a lower blepharoplasty is typically the best surgical solution. Lower eyelid surgery is not about removing the muscle, but rather using it as a bulking agent to add fullness to the area, allowing your eyes to look more natural. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Anticipating your results is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want, and more importantly, what you don't want. Once all of your options are discussed and your questions are answered, it's time to book your appointment.